I welcome you to my channel once more. It is a great thing to always do videos for people like you. I'm chilling in here because I'm grateful that all my organs are working very well. When your organs are working very well, you can always chill. Yes, you can always chill. I tell you, you can always chill. But one of the most vital organs in the body is the kidney, and that's what I'm going to really expose you to, so that you can come to realization of how you can monitor and evaluate the function, the effective working of your kidney. The kidney is a very vital organ which, if left unmonitored and unevaluated, may deteriorate to the level that you will start needing dialysis and finally kidney transplant. So that we don't come to that level, just click the like button, subscribe, and press on the bell, so that I take you on a journey into the laboratory diagnosis, early laboratory diagnosis of kidney problems, and by the grace of God, we will not experience a serious kidney. I can now take you on a journey of how to effectively monitor your kidney. Many people don't even know much about the kidney. They see the kidney. From the layman perspective, the only concern the layman will show about the kidney, if you ask him, does he know much about the kidney? He will tell you yes, that he knows the kidney is being shaped and is in the suya that he eats. But when you talk about kidney transplant, yes, they talk about it. But in all honesty, they just know that the people need kidney transplant. That's the maximum. From the perspective of the World Health, the World Health shows concern. It has not gotten to a stage where it will really declare a kind of war on it. So it's just a concern. And it's not even the World Health that declare the 2nd of March, the second Thursday of March of every year, as World Kidneys Day. So it's just a concern. So in the area of concern, there comes the risk factors. What are the risk factors? What can really make one prone to having kidney problem? You can talk of salt intake. Too much salt intake will really cause eventual damage of the kidney, and the high blood pressure, you don't even know which one comes first between high blood pressure and diabetes. So these two are also factors that affect, could be risk factor or causes of what can cause the damage of one's kidney. Fructose is another sugar substance that affects the kidney. So when you take too much fructose into your system, it affects your kidney. So the concern is more of watching one's weight, obesity, and diabetes, and drinking water. That is where the concern is. But I haven't said that much. What about the federal government of Nigeria concern? Yes, the federal government of Nigeria concern can be seen from the perspective of what they do with the public health section, the public health centers. The public health centers are not kidney centers anyway. You don't have any kidney department or anything set for it. But you have things that could lead, that could even show that the person has kidney problem. You have the measure of taking the high blood pressure and also checking for one's sugar. So when the clinician has seen that this is more of a kidney problem, the person is now referred to the secondary institution, general hospitals, or tertiary institution, depending on how serious the kidney problem is. The kidney problem could lead on to kidney failure or chronic kidney disease that eventually may need dialysis, and after dialysis, either a transplant or death. So it is a serious problem. Whether we like it or not, it's a serious problem. But the concern about it is left for us. You can imagine God gave us 2 kidneys two kidneys, and some people live over 100 years and their kidney are still perfect, whereas some people are not up to that age. Their kidney, they are already needing kidneys. So the two kidneys are already damaged. At times you want to think it is familiar, that is in the family. Like diabetes is also in the family. So some people will always come out with auto-agglutinists that will attack the nephrons, the kidney organ, the section of the kidney, the unit of the kidney that really performs the function of filtering all the waste of our blood. It really filters it. So when the kidney is not able to filter all those poison toxins and co, that's why when it starts to fail. So to that extent, the federal government has helped a lot by making a referral to the institutions, secondary and tertiary institutions that will take care of such a problem. The medical laboratory scientist concerned can now be seen. The medical laboratory scientist is not necessarily about curative alone. It is when it is a curative aspect that you find that a clinician will have to refer the sample to the doctor. But the role of the medical laboratory scientist should be seen more in the prevention of kidney problems, preventing one from having a damaged kidney. Two, for monitoring your kidney, even where you are having kidney scares, because the kidney does not regenerate itself, unlike the liver that regenerates, the kidney doesn't. So with that information, all you need to do as a lay person is to visit the medical laboratories, diagnostic laboratories, so that they can help you do certain tests. The kind of tests they will do is to check the present situation of your kidney. What do you know the present situation of your kidney? It's like the present situation of a car. You can only get it from the function. You want to buy a car, you want to know how the engine sounds. So you want to get know the present situation of kidney, you want to know how it functions well, because how it filters well. So there are certain parameters that I shall now go into when as we talk, as I'm talking now. So what are the parameters? It can be divided into two. There is the biochemistry aspect, where you now take the usual sample. It is just what is filtered out from the kidney. The kidney effectiveness can only be seen in the urine. So when you see the urine that the person produce, the medical laboratory scientist will first of all look at the appearance. That's the macroscopic aspect of the kidney examination. So it looks at the appearance of that urine. If the urine is cloudy with offensive smell, it starts suspecting that there is a bacterial infection. But because normal urine is usually clear, except when you are taking some herbs or what have you, which can affect the color of the urine. Some pigments, those pigments will affect the coloration of the kidney. But the laboratory scientists, by doing the thorough check, will be able to know whether it's a kidney problem or just the intakes of herbs. The other thing we must talk about is when the urine appears red and cloudy, you start suspecting blood. You start suspecting urinary schistosomiasis, though that really stays somewhere around the bladder, and your urine will affect. So it does not really affect the kidney. The schistosomia parasite, schistosomia hematobium, does not stay in the kidney for real, but in the bladder region. Then there are other colors which you now suspect the liver aspect. That is, when it is greenish or yellowish, you start suspecting whether there is a bilirubin problem or hepatocellular problems that is not really a kidney problem. But nevertheless, these are things you look at from the appearance. So the appearance tells you whether it's a normal urine that the person is producing or not. Then the biochemical aspect, you go on to check the protein. Protein is a high molecular weight substance. So the kidney has the nephrons. The nephrons filter. It's like the filtering, it has holes. So when there are high molecular substances, they cannot be filtered. They don't pass through those holes. So your protein are not expected. The proteins are not expected in your urine. So when your urine contains protein, it shows that the kidney is getting gone, is getting damaged. So if it's starting, then you know how to now stop it. The lifestyle and what you are doing that could cause it. You know, we have mentioned obesity and high blood pressure as part of those things that could really cause the kidney damage. Then outside the protein, there is also the dangerous one, benzoate protein. Benzoate protein is when there is a cancer of the blood. If you see benzoate protein in the urine, then you start suspecting not that the kidney is damaging, but that there is a cancer of the blood, because it affects the blood and it will cause tumor in the bone marrow, in the bone of that patient. We also have glucose. If glucose is being detected in your urine, then it means the patient is diabetic. There is no two way. It is very common for people to talk about you urinating on the ground and seeing flies or ants gathering around it. That much tells you that the patient is diabetic. The same way, when we see glucose in your urine, we are already suspecting that you are diabetic, because there is no two way. The threshold before glucose can come out in your urine there is that high threshold that you must have passed, which is now in the region of being a diabetic patient. At times, your vitamin C can cover the appearance of this glucose when you use ordinary strips, because that's the thing that is used at the chemistry level to test. It will cover up the glucose and it will appear as ascorbic acid, which with experience, the medical laboratory scientists will know what next to ask for. You can even ask for blood glucose. So the chemistry will also show you the pH. Your normal urine should be acidic. When there is deviation or whatever, you start suspecting there is an underlying problem. What could be the problem? That is what you want to know. So the chemistry goes into the microscopy, where you start now move into checking the content of that urine. If there are red blood cells in that urine, the microscopic examination will bring it out. If there are white cells in that urine, the microscopic examination will bring it out. But a normal urine should not contain red cells, because like I told you, proteins are not supposed to pass through the filter of the kidney. The filter of the kidney is called the nephron. But like I earlier mentioned, if there are familial problems, a person could suffer from glomerulonephritis, and if one is very hypertensive, it could also affect those filters. The scars never heal. So when the kidney is being checked, monitored from time to time, the quantity of water you are taking that you probably is not enough will be asked to take more, because water dilutes the toxic substances. And so if you are not taking enough water already, you are poisoning your kidney, the nephrons. There are so other things that go Yeah, if you like what you are listening to, like I've always said, just subscribe. Click the subscribe label. Click on the like button. Click on the bell for notification, and it will continue to come out exactly. And I'll be able to do more content work. Continuing from the microscopy, the other important things are things that are not supposed to be there. If your urine has Trichomonas vaginalis, it has to be reported. If it has yeast cells, these are things that damage the urine. And most times, the urethra for women is shorter. That's why women suffer more from kidney problems, chronic kidney disease, because they have a shorter urethra. And being short, it means the organism, bacteria, parasites that are within the distal part of the urethra can easily travel up. If you shorten your, if you don't urinate quickly and you allow water, your urine to stay longer, it will travel upward and can affect the kidney. So when we see all these things in your kidney, they could go on to damage the your urine, they could go on to damage your kidney. So we have to really inform you so that you can start treatment to remove all those things that are the urethra where you urinate from, because these are holes that are exposed to the environment. And especially one is advised that after sexual intercourse, try and urinate out so that you don't transfer all those organisms back to your kidney. It will damage the kidney. So the culture aspect, where we suspect there is serious infection, we have to culture it in the laboratory, and whatever it grows, we now do antibiotic testing on it to know the correct drug that would take care of it. The next topic for sure shall be the urinary tract infection, because I cannot treat everything now, so I shall defer more talk on urinary tract infection. But if you like what you have heard so far, please click on the like button, press the notification bell, and click on subscription. Thank you for listening.